All rise. The Court of Simulation County is now in session. The Honorable Judge Jason Sockwell presiding.
Please be seated. All witnesses are reminded of their oath and sworn to obey its principles. Mr. Prosecutor, you ready to call your first witness?
I am, Your Honor.
Please proceed.
Your Honor, the county calls Mr. Michael Gossett. Mr. Gossett, are you a nurse at the Simulation Hospital?
Yes, I am.
And are you also familiar with the case before us today?
Yes.
Well, according to Ashmill and Caruso, pointing can cause burning. Do you believe that this is a form of child abuse?
Yes, it is. In addition to burning, pointing causes damage to the capillary beds and subsequent bruising on anyone that the procedure is performed on. An adult can make the decision whether or not to have the procedure performed on them, but this is forced upon a child by the parents or grandparents. And seeing how it has no proven medical significance, it should be considered abuse.
So in your expertise, would you suggest removing the child from the home?
Objection, Your Honor. The witness is here as a nurse expert, not a social worker.
Sustained.
I will draw the question. No further question, Your Honor.
Mr. Curtis, your witness.
Mr. Gossett, are you aware that traditional medical techniques such as coining have been in practice for centuries?
Yes, I am.
Are you further aware that these practices have been passed down from generation to generation and have been shown to have certain therapeutic advance, even if it's just a matter of touch?
Yes, I am.
And yet you still say that this centuries-old practice, which according to Ruth Davis, is still being used by many Asian Americans and the Southeastern Asians, is considered child abuse?
Yes.
And surgery such as a tonsillectomy or an appendectomy, which also causes pain and damage to the surrounding tissues, is not child abuse?
The children are placed under anesthesia for those procedures.
But there is still pain.
Yes, there's still pain.
Nothing further, Your Honor.
Mr. Gossett, you are excused. Mr. Prosecutor, please call your next witness.
No more witnesses, Your Honor.
Defense, call your first witness, please.
Your Honor, the defense would like to call Mr. Jeremy Long to the stand. Mr. Long, would you care to tell us about your nursing experience?
I'm a community health nurse who specializes in pediatrics.
Okay. Could you tell us what you know about coining, please?
I know that it's a very important cultural practice in Southeast Asia. It's prevalent in Vietnam. I also know that coining has been shown to have a therapeutic effects such as acupuncture and massage, and it's gaining popularity amongst medical professionals.
Okay. So is it your contention, sir, that coining is child abuse?
No, it is not. Traditional medicine does cause a certain amount of pain. In fact, 90% of the procedures performed by our trained doctors and nurses cause pain. Furthermore, the oils that are used, the menthol oils, that are used in the coining process are used in by modern medicine to cure many ailments.
Okay, so why the debate?
The debate comes from the fact that practitioners of cultural medicine are not trained in the traditional sense. It's something that's passed on from generation to generation, which makes it difficult for the Western countries to accept.
Thank you, Mr. Long. Nothing further, Your Honor?
Mr. Gill, your witness, please.
Mr. Long, do you expect us to believe this cultural medicine is therapeutically significant?
The ethical ramifications of a belief system is what this trial is about.
But still, the child cringed in pain at just the touch of a stethoscope. Doesn't that seem severe to you?
I concede that there was pain involved. However, what you have to see is, just as the orthopedist can reset a broken leg, the mother was doing all that she felt she could for the child. Just the fact of her helping was therapeutic.
No further question, Your Honor.
Mr. Long, you may be excused. Defense, call your next witness.
Your Honor, the defense would like to call the child's mother, Miss Stevie Oldsfall, to the stand. Miss Oldsfall, would you kindly tell the court and the members of the jury why this practice of coining is considered acceptable to yourself and others from your culture, even when it is proven to cause pain?
Coin has been used in my husband's family for years, and even though it may cause some discomfort, it has been used for healing many minor ailments.
Okay, so what you're saying is we're looking at a centuries-old practice. It's used to cure very, very minor ailments, and it does have a positive impact on the body. Have you yourself been coined?
Yes, I have.
Okay, do you believe that it helped you in any way?
Yes, I do.
Okay, thank you, Ms. Oswald. No further questions.
Prosecution, your witness.
Ms. Oswald, you stated that you've had the coining process performed on yourself and that it helped you feel better. In what way did this process help you feel better?
I don't like to constantly take medication, so I like to use alternate forms of healing for things like headaches. My husband and his family believe that coining releases bad wind and helps with circulation.
So you expect the people of this court and the members of the jury to condone the practice due to the fact that it releases bad wind from the body? Are we also to believe that the release of this bad wind is important enough to turn our backs on the fact that your own child cringed in pain?
So, do you believe that people should not be able to practice their own beliefs and rituals of their country just because they move to another? There are many things that seem odd to people outside of a certain group, but are acceptable within that group. I recently read an article where women talked about coining in their families. In the article, Cultural Health Care and Child Abuse, a woman talked about how coining wasn't any worse than a child getting braces. And some braces are for medical reasons, but most are aesthetically motivated.
Well, as to what I was saying before, is it not abuse to inflict pain on another person regardless of the reasoning? I would ask that you honestly take a look at the evidence presented in this case. The child cringed in pain. Is that not enough to rule this as abuse? No further questions, Your Honor.
Ms. Oswald, you may return to your seat. Prosecution, you may now present your closing argument.
Is it not our duty as human beings to protect those who do not have the power to protect themselves? We must look at this case as exactly that. I would ask you to imagine yourself as an innocent child and have this procedure performed on you. I believe in the depths of my soul this is abuse, and I would ask that you rule this as abuse.
Thank you, counsel. Mr. Curtis, your closing argument.
Thank you, Your Honor. In this great country, we've opened our borders to people from many different countries. And I think it's time we opened our hearts and minds to those same people. They have cultural practices just like we do. Kaigao is just one of those practices. It is a belief that has been formed in Asian cultures for centuries. It is something that has been done for so many years. Couldn't it be possibly found to be therapeutic? I ask you, members of the jury, to open your minds and open your hearts to the practice of other cultures, and please rule in favor of the defense. Thank you.
Thank you, defense. Members of the jury, take a moment, if you would, and consider the evidence and the testimonies that you've heard here today. With this in mind, this court finds in favor of the defendant. We as a group find that coining is a therapeutic cultural practice, not child abuse. We ask that you as future nurses evaluate your beliefs and determine your own responsibility to autonomy, decisions based on cultural practices. Thank you.